Upstate Medical University in Syracuse, New York invites you to Be the Informed Patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. A physical therapist and researcher is seeking volunteers for a study that uses a non-invasive brain stimulation technique as a novel treatment for chronic headaches and other post-concussion symptoms in people with mild traumatic brain injury. Here to talk about this study and how you can get involved is physical therapist Yi-Ling Kuo, who is an assistant professor in the Department of Physical Therapy Education in Upstate's College of Health Professions. Welcome to the Informed Patient.
Thank you for having me.
What is this non-invasive brain stimulation technique?
The technique that we're going to be using is called transcranial magnetic stimulation, or TMS. It is a type of non-invasive stimulation technique that stimulates your brain, but without opening up your skull, and we read some findings with some signals so that we get to know what's going on inside your brain indirectly. There are different forms of TMS. Some forms are used for assessment, which means that we monitor your brain status. And other forms are called repetitive transcranial magnetic stimulation, or RTMS, which is the form that's going to be used in this study. And it has the capability to modulate the brain status so that it's used for treatment.
So there's no incision. The magnets do their work through the skin, through the bone, through the muscle.
Exactly. Yeah.
Interesting. Can you tell me how magnets affect the brain?
So the stimulation coil will generate magnetic field to stimulate the brain. The magnetic field will make current generated in the brain, and that electric current will stimulate the neurons in the brain. And this mechanism is called electromagnetic induction, and that was discovered by Michael Faraday in the 19th century. So the stimulated neuron by the current will then activate and fire and generate potential to move your body. So we capture the response in the movement to tell what's going on inside the brain in an indirect way.
Is this already being used to treat regular headaches?
So currently, the use of RTMS in headaches is in an investigational stage, which means that used in only research. It's not being FDA approved for headaches for clinical use yet, but RTMS has been FDA approved for other mental illnesses, including depression, which is the most well-known one. So we're using RTMS in headaches in the study as an off-label application.
I understand you've been involved in brain stimulation research for more than a decade. Have you always focused on magnets?
Myself, yes. So my research is primarily in TMS, but there are actually many other forms of non-invasive brain stimulation, including, for example, transcranial direct current stimulation that uses electrical current to stimulate the brain, or ultrasound stimulation, or near-infrared light for stimulation, etc. But for myself, yes, TMS is my primary focus.
Please walk us through how this transcranial magnetic stimulation works. Is this done in a medical office or a hospital?
For clinical use, it is used in a clinic, so it can be, a clinic or in a hospital. But for research use, so like us, we use that in a research laboratory.
And are patients sitting up or laying down? How is this applied to them?
So they will be reclined sitting in a chair. That chair will be similar to a dental chair, so that recline the chair and the patient can be lying on that chair.
And they don't need to shave their hair or anything. This works right through their hair, right?
Exactly, yes. So the magnetic field penetrates the air, the hair, and the skull to reach the surface of the brain. We don't require any preparation of the hair to be shaved or in any other way. The patient can just receive TMS as they are after they walk into the clinic or the laboratory.
So is this like a hat that goes over their head?
Well, we use a coil that's connected to the stimulator. So the coil, it can be in different shapes, but the most commonly used and the one being used in our study is in a figure of eight shape. So that coil will be placed upon the head and to generate magnetic field to stimulate the surface of the brain.
What do the patients feel during the treatment session? Or I guess I should call them subjects because it's a research project. What do they feel
Mhm.
during the treatment session?
So there will be tapping kind of feeling on their scalp. It is painless, and the strength of the tapping will depend on the stimulation intensity. So if I turn up the intensity a little bit more, they may feel the tapping to be stronger, but it is always painless. Some people may feel the stimulation being spread out to their facial muscles. So they may experience some twitches in their facial muscles. And also, depending on where we target in the brain area, for example, if we target the motor area, let's say the hand, when we stimulate the hand area in the brain, the subject may feel muscle twitches in their hand as well.
Interesting. So I know you're monitoring during these sessions. What is the goal of these sessions?
We monitor the participants using some signals. For example, electromyography or EMG is the one that we use to monitor muscle activity because in this study, we target the motor area in the brain. So those signals will be analyzed to help us interpret what's going on inside the brain. But other than the muscle activities, we will also monitor the participants in their facial expression or relying on their reports to us to see how they respond to the treatment during the experiment.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with physical therapist Yi-Ling Kuo from Upstate's College of Health Professions. Now, Dr. Kuo, for the study, what people are you looking for?
We are looking for people with mild traumatic brain injury with chronic unresolved post-concussion headaches. So if people have chronic headaches for more than 3 months and that's not resolved after standard care, and those will be the target for our study.
What is traumatic brain injury, and how would a person know if theirs was mild or more severe?
A mild traumatic brain injury typically means that after the person hit in the head, for example, due to motor vehicle accident, sports injury, or full accident, those symptoms will not be life-threatening. And typically, there's no pathology detectable with neuroimaging like CT or MRI. So that's why they are considered mild. And typically, symptoms go away within a month with proper management. But some people, their symptoms might last outside of the normal recovery window. And for those who have headaches, for example, that will be the target in the study.
How long ago could the people have had a traumatic brain injury in order to be included? Do these have to be relatively current?
Well, we do not limit the onset time of the headaches or the concussion to be enrolled in the study. It's that we set the inclusion criteria to be the timing or the length of the headache that's going on out there. So chronic headaches for more than 3 months, and if the patient went through standard care and that's not resolved, and those will be the target for our study.
Are there any other symptoms besides headache that you're also including?
Well, so we will also monitor the changes in other post-concussion symptoms, such as dizziness, difficulty concentrating, anxiety, memorizing issues, or trouble sleeping. Those are secondary symptoms being monitored, but for the main thing being studied in the study will be headaches, the chronic ones.
And are you looking for men, women, what ages, races?
We will be recruiting both men and women. There's no limitation in race, and we would be targeting adults, so they need to be older than 18 years old.
Is there anything that would exclude someone from participating medically?
Mm. Well, if someone's headache happened prior to the concussion or the diagnosis of mild traumatic brain injury, that means their headache came from something else, then those people won't be studied in our experiment. And for people who have metal implants inside their body that has electromagnetic field, for example, a pacer that's helping their heart to rhythm, those patients will be excluded as well. And also someone who has a history of seizure or epilepsy, those people will be excluded as well. And we do use safety screening questionnaires just to make sure that the patients are eligible to receive TMS.
Will all the volunteers receive the TMS therapy?
So in the experimental stage, they will be randomly assigned to either receive active or sham stimulation. So sham means that there's no active or real stimuli being applied to their brain. And this is for scientific methodology purposes to minimize the effect of placebo. But after they complete the experimental stage, they will be unblinded to know which group they were assigned to. And for those who are in the sham group, can opt to receive active RTMS after we're done with the entire procedure. And we offer that at no cost.
I see. Now, if the volunteers are signing up for this, what's expected of them? How long are the sessions that they go to, and how long does this last?
We would ask the volunteers to keep a total of 12 sessions of appointments to the laboratory. And also throughout the treatment course, within 4 weeks, we will ask them to complete a daily diary to track their headache intensity, frequency, things like that, and also sleep and their physical activity levels. And we would also ask the participants to not start a new treatment for their headaches while they are in the study.
So 12 sessions, would that be spread out over a year or less or more?
12 sessions will be spread out in 4 weeks typically. So we do 3 times a week for a total of 4 weeks to complete those 12 sessions of RTMS.
So what's the best way for someone who's interested in participating to learn more?
If they are interested in participating, they can contact us through my email address, kuoy@upstate.edu.
What do you plan to do with your results?
We will eventually publish the findings in scientific conferences and journals. So that's the first thing. Secondly, we would use the data to obtain future funding so that we can refine our TMS protocols and to better individualize to maximize patient responsiveness. So we do expect the preliminary results to be out in a few months, probably in a conference. And the completion of the entire study will be probably 1 to 2 years from now. And also, we are happy to send the results to the participants if they are willing to know what's happening.
Very good to know. Dr. Kuo, thank you so much for making time for this interview.
Thank you so much. And I look forward to any participation that we can welcome.
My guest has been physical therapist Yi-Ling Kuo, an assistant professor in the Department of Physical Therapy Education in Upstate's College of Health Professions. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.